Are we ready? So this is what cracks me up when I'm editing. Because I'm like so intense on the editing that
then you get
I make myself laugh. It's really funny. Okay, let's do tennis elbow first. 5, 4, 3, 2, 1. Okay, so now we're gonna move on and take the tennis elbow, which basically is where the radial head is interjecting into the shoulder joint with the humerus and the ulnar here. Lots of tissues in here overlapping in different directions, and it doesn't necessarily have to be tennis, right? It can be all sorts of things. There's a lot of glass blowing artists in town here. Huge, from the rotation of the pipe. So it's all walks of life. You know, maybe improper throwing and baseball mechanics for the teenagers, and softball pitchers. So home moms and dads and coaches can step up and do this too. It doesn't have to be the local chiropractor, right? Teach a neighbor to do it. So with this one, we can do a few different things. We can take the full pre-cut strip. That's probably the way to go. And with an adult, you'll want to do the full, and with a small adult or child, you can do maybe, if you feel like you want to do halves or, 3/4, you can play with that a little bit. So we're going to do a few different angles, and then I'll just change colors so we can see this. So we're going to take about halfway. I'm just going to do a twist and rip, super easy to do. And then I'm going to do a peel back like so. And then I'm going to grab it and leave the ends like this. I'm going to have her keep the thumb and everything basically like that. That way she's not twisting this way. She's not twisting extensively this way. She's basically in a neutral. And I don't mind if the arm's here. I don't mind. I mean, obviously this would not be conducive, but you know what? You work with what you've got with these patients when they come in. So I like to start here on this surface, just doing a slate pull, laying it down here, and then gently just guiding it here, but having it adhere here. So I'm just trailing it with a pull and guidance, and then what we're gonna do is I just want to angle you a little, and we're gonna wrap up in here. So let them see what we've done there. I'm just gonna slightly get that to attach, and then get that to attach. And you can see here that it's, I don't know if the camera's picking that up, but it's bubbling there, and it hasn't attached there. So I actually am gonna have it, I'm not gonna straighten it, I'm gonna leave it bent and attach it, because I like that it'll create a little bit of a pull when she straightens it. So that's how this one is attached. That's about mid tricep, about a finger's length, half of a hand up, and then a half a hand over. Doesn't have to be exact, but that's a good place to start with that one. The next one is, let's see here, change colors. Let's go with green. We're basically gonna go in the other direction. One of the things that I learned in acupuncture was surround the dragon, which is a saying that they like to say, where sometimes patients are like, I just don't know where to put the tape. I'm like, I don't use surround the dragon. I say X marks the spot. So if you know that the epicenter of majority of the pain is in one spot, sometimes it's just good to just put 2 pieces over that. And if it's like a quad, put 3 pieces and just star it out. And that will be really helpful. So I'm going to take you across this way just for the camera. We're going to bring this one across, literally across that joint right there. And we're going to try to stay away from this skin here. Super supple in here. So when you tape here, because we're going to tape this in another video, the warning for the patient is going to be, this is going to be a little tender to remove. With women, it might just rip it off. No, what you want to do is always remember, like I stated in the intro video, is to remove it soaking wet. And some people, it'll just fall off when they're exercising and such, but especially, with tennis and everything. So what I'm going to do is show you just anatomy-wise where we're going here. We're gonna basically come right off the elbow and come across because we wanna visibly make a mental map before you tape, because once this tape goes on there, you don't wanna keep burning through your tape. So we're gonna come, like I said, across here, and we're gonna try to end coming up the bicep where the skin gets more sun and it doesn't mind the tape being removed. There's your warning on that, right? So I'm gonna open it up to about here. We're gonna do a slight pull. This would be 100%. And I don't wanna overstretch this, but this is me not pulling at all. This is me just doing a slight pull and not 100%. So I'm gonna basically lay that one there, move her around so it's convenient for me. We're gonna do a guidance with one hand and a push, a tap, and just lay it on the skin here. You can see here that that one again isn't adhered. We're gonna do that at the end. I'm still kind of pulling a little. And I don't know if you can see that, but I'm pulling and attaching, and then I'm gonna leave that last inch not doing that. So this isn't a big deal to me. It's a really big deal to some when you watch other videos, but really depends on the joint and how close to the joint you are with whether you want to extend it or fully flex it, because you're stretching the skin. And depending on their, I mean, if they're sitting at a desk all day, it's not going to be that big a deal. But if they're getting ready to go pitch a game, it's going to be a big deal. This isn't adhered yet, so I am actually going to push it on there and then go into extension and get that to attach. There's some lotion there or something. Okay, so those are the two pieces. Boom. For tennis elbow, or just elbow pain when they point to, it's hurting right here. Ding! Sorry. Toast is done.